Hey guys, so I'm just hearing about this morning, but this article is from the 12th, a few days ago. It's there is a deadly drug-resistant fungus that was discovered in Mississippi, you guys. So, January 12th, and this is from the Clarion Ledger. An emerging fungus presents a serious global threat as it spreads rapidly throughout the state and nation, according to the CDC. Candida auris is multi-drug resistant and difficult to identify with standard laboratory methods, and it can be misidentified in labs without specific technology, the CDC said. Multiple healthcare facilities in several countries have reported that a type of yeast called Candida auris has been causing severe illness in hospitalized patients. For some patients, the yeast can enter the bloodstream and spread throughout the body, causing serious invasive infections. The Mississippi State Department of Health reported, as of Thursday, a total of 6 cases of the invasive infection, with 2 deaths and 37 colonized individuals have been identified statewide in Mississippi since November 2022. What they mean by 37 colonized individuals is that there are 37 people who have been positively diagnosed with this yeast infection. So they call it colonized because, yeast grows in groups and whatever. It's disgusting. Anyway, this yeast infection does not respond to commonly used antifungal drugs, making infections difficult to treat, the CDC said. Patients who have been hospitalized in a healthcare facility for a long time have a central venous catheter or other lines or tubes entering their body, or have previously received antibiotics or antifungal medications, appear to be at the highest risk for this infection of this yeast. Not only has the deadly virus spread throughout Mississippi, but experts at the Hackensack Meridian Center for Discovery and Innovation in New Jersey said the fungus has taken hold in health facilities in southern Nevada, sickening at least 600 and killing another 63. Below are a few helpful tips provided by MSDH and the CDC on precautions to take. The spread can occur through transmission resulting from contact with the affected patients and contaminated surfaces or equipment. It mainly affects patients who already have many medical problems. But you guys, it can affect anyone. So don't think because you are of perfect health that it can't affect you. Yes, if your immune system is a little stronger, then it may be harder to be infected, but it can affect a healthy person, believe me. It often affects people who have had frequent hospital stays or live in nursing homes. CRS is more likely to affect patients who have weakened immune systems from conditions such as blood cancers or diabetes, receive lots of antibiotics, or have devices like tubes going into their body. For example, breathing tubes, feeding tubes, catheters in veins, or bladder catheters. Healthy people don't usually get CRS infections. And the key word is usually, so still be careful, wash your hands. If you're visiting someone in a nursing home or hospital, always wash your hands and do not walk into your home with those shoes until they have been thoroughly disinfected. I do not walk in my house. I have outside shoes and I have my inside shoes. And yeah, I guess you can say I'm a little OCD when it comes to that. That is true. But it's better to be safe than sorry, right? You never know what you're going to track in when you go to those places. Anyway, you guys, stay safe out there. Wash your hands, wash your hands, wash your hands. If you're visiting, take those clothes off, throw them in the washing machine, and jump in the shower, because, just because you don't think that you can get it because you're healthy doesn't mean you won't. So be careful. I haven't heard much about this anywhere, but it is out there and it is spreading. So look at this in southern Nevada. How many of you are in Nevada? Have you heard about 600 people being sick with this fungus and 63 dying? That is a crazy number, not to be all over the news, right? So let me know what you think about this in the comments.